foot phantom back. Bunions versus Hallux Limitus versus a Callus. Here we go. All right, so guess what? This patient has them all. Patient has a bunion, patient has a callus, patient also has hallux limitus, which is just very limited motion of the great toe. Here you can see a huge callus along the medial aspect of the first metatarsal, which obviously is causing an enormous amount of pain and discomfort. So how does this happen? The capsule along the medial side, on the inner side where the arrow is pointing, becomes very loose. The tendons and ligaments, as the patient ambulates, takes advantage of the loosening of this capsule. The great toe begins to migrate over the second digit and begins to plantar flex, or pushes the first metatarsal downwards, causing increased pressure along the bottom of the foot. Of course, this is a progressive deformity and is a function of deformity. The more the patient walks, the more the toe migrates laterally, and of course, increased pain and callus formation with weight bearing. On the inner side of the foot, you can see the bunion in combination with the callus right there where the arrow is pointing. This is an area of increased pressure and discomfort, and it is feels as though you're walking on a pebble on the bottom of the foot. So what can be done in order to correct this? In order to evaluate a radiograph of this foot, there is severe unifocal joint space narrowing noted along the great toe with severe articular degeneration, which can be noted as you compare the lesser metatarsal phalangeal joints, which are pointed here, as compared to the great toe joint. You also have some erosion along the great toe medially along the first metatarsal distally. As you can see here, here is the medial oblique view. The same kind of deformity is noted as you look at the lesser metatarsal phalangeal joints as compared to the great toe. There is severe unifocal joint space narrowing noted along the great toe as compared to the lesser digits. You can also see that the second digit appears to be extraordinarily longer than the great toe in this instance, which we will try to correct as well. On this radiograph, the same findings are noted on the great toe, but we also want to look at the midfoot area where the shaded area is pointing or is indicating. You can see that there is no coalitions, which is two bones which come together usually at birth and are fused together, preventing full range of motion and movement of the foot, which may aggravate this issue. Here you can see there is also a callus noted beneath the second toe, second metatarsal phalangeal joint. The arrow is indicating here in this area. You will see shortly also a very thick callus noted along the great toe area, with the great toe overlapping the second digit, which causes an enormous amount of discomfort with wearing any kind of closed-toed shoe. And the severity of the great toe overlapping the second digit will also be noted. Here is this huge callus, which is mainly on the plantar aspect of the first metatarsal. Any pressure along this area feels as though there is a pebble underneath the foot. Just to try to figure what that would feel like if you are ambulating with a small rock underneath your great toe. It is nearly impossible to function and to perform your activities of daily living without this extreme discomfort. This is a bilateral deformity. You will notice on the left foot there is also this huge callus. In fact, this callus is thicker than the one on the right foot, but due to its location, the patient has less pain and discomfort in this area as compared to the contralateral limb. You can also see here the severity of the great toe overlapping the second digit. Here also you can see that there is less callus formation noted underneath the second digit, which would indicate less pain and discomfort in regards to the firmness of the callus. The patient had attempted utilizing wide-toed shoes as well as callus debridement without improvement of either the right and left lower extremity. When you get a second, please don't forget to click the subscribe button below. So here we go. Here in the preoperative video, you can see the dorsal view, the severity of this deformity. In fact, it almost looks as though it's a hand that is overlapping the toes, with severe callus formation noted on the inner side, and this is on the medial side of the foot and is causing extreme pain and discomfort, but we will correct this. Here is a post-operative of an arthrodesis, or a fusion of the great toe in a rectus position. You can see there is a slight decrease in the length of the great toe as compared to the second toe. Sometimes this will cause pain and discomfort noted along the bottom of the lesser digits. I was able to maintain length in regards to the great toe. The bump on the inner side of the foot, as you can see post-operatively, is mainly callus, which I removed in this post-operative picture. You can see the discoloration changes consistent with bruising throughout the entire foot, with a small amount of swelling along the great toe. Those are steri strips over the surgical incision. I use a subcuticular stitch, which is tied externally, so it's actually only one stitch, which starts at the distal aspect of the toe and extends approximately subcuticularly. Here are the post-operative radiographs. As you can see, the intermetatarsal angle as well as the hallux abductovalgus angle has been corrected to nearly 0 degrees. You can also see that the second digit does not appear very much longer than the hallux in the radiographic evaluation, which will significantly assist with decreased postoperative pain along the second metatarsal. Here is a comparison view before and after the surgical correction of the first metatarsal phalangeal joint with arthrodesis, with plate and screw fixation. You can also see that the metatarsal parabola, in other words, comparing the first metatarsal length as compared to the lesser metatarsals, is almost in a corrected position. In this view, you can compare the preoperative and postoperative views of the foot. As you can see, the discoloration that I'd mentioned before is mainly bruising and, of course, swelling, which causes increased discoloration along the area of the surgical incision. But the corrected great toe as well as the callus were removed in this post-operative picture. If you like this video and you want to see more, please subscribe, like, and follow. Foot Phantom out. See you soon.